So let's talk about this injectable composite, as we call it, and how it differs from flowable. In essence, the way to think about this is that this is traditional or compactable composite in a syringe. So anywhere you use composite, you can use injectable composite. And I'm specifically referring to Genial Universal Injectable Composite by GC. And it's an outstanding product, which I've been using about 4 years. And in general, 8 years of all injectable composites, their predecessor to this, I use too. So here, any application is good. Class 1, very simple. Class 2s, take a little learning curve. I'll show you how that works out. Class 3s, Class 4s, you can build up with it too. The small ones that work really well. And of course, Class 5s, that's really a great place to start with this. So you really have a lot of versatility in any class restoration you want to use. And what makes it very unique is, as dentists, since we inject all day, this is an injectable scenario. So it's got a very natural ergonomic feel for me as a dentist, and for anyone for that matter. The placement is quick. You're not carving out a little piece of what we would call convenience form from a syringe, or picking up a gun using a unidose material and placing that into the cavity preparation. Here, pick up the syringe, fresh tip, and insert it. And your instrument, as I say, this really eliminates some instrumentation. Your instrument is the syringe tip in essence. So as you place it, you draw back and you build the restoration up from that point. It also comes Genial bulk injectable in a bulk fill version, which of course will have a greater depth of cure, whereas the incremental placement, or say like the non-bulk, would be in the neighborhood of around 4 millimeters of depth of cure, I should say. The injectable, the bulk you can get down to, say, like 6, in that range typically. So same situation with this. Very important concept here is that, unlike flowable composite, which you see here to the center, this injectable composite has low wear. And this is comparable with a compactable or traditional composite, which is in the neighborhood of 3 microns a year, versus flowable would be up to 16 or even more. So keep that in mind. This is a very different situation. Think of it as your traditional condensable, compactable composite in a syringe. That's the best way to think of this conceptually. And it's different from flowable in that regard. Comes in all shades, as a matter of fact, and opaque shades. What's unique about Genial Universal Injectable is that you have a uniform particle size. So what that means is, when wear occurs, toothbrushing occurs on the restoration, you're not getting plucking of larger pieces of composite, or I should say filler, that would leave the surface less shiny. So this will maintain its shine like a microfill from years ago would, which is very unique. So you won't have someone come back and have that kind of like satin finish to it. It'll stay extremely polished. And that's where that plucking doesn't happen with this. And that's what I'm saying. You're dealing with something that's uniform particle, but they're nanoparticle. Look at the strength. It's up there comparable with compactable or traditional composite.